Okay, well, again, I'm Dr. Purita, and I have the honor of talking about a product that comes from Italy. So you would wonder, why is an American going to talk about an Italian product? Well, I got to say one thing. My family comes from Calabria, so I'm sort of a paisano. Anyway, let's talk about... all right, we're going to talk about the Lipogems system. Lipogems is a very, very good system. This is a system that utilizes fat. Now, like I said in my lecture this morning, fat is a treasure trove of stem cells. But the problem that we have is many times it's difficult for us to get the fat cells in a very good fashion. Now, Lipogems is based on a lipofilling technique. It's also based on a non-enzymatic technique. That's very important for us in both the United States and here in Europe. Enzymes are a problem with our governments. Okay, but you know what? Enzymes are also a problem from a scientific point of view because they don't work as well. Enzymes are old technology. So if you want to drive an old car, be my guest. If you want to drive a new car, a new Ferrari, this is the new Ferrari, Lipogems. All right, so basically, let's look at fat. What is fat? Basically, it's a very good source of stem cells. And we look at the heart, we have 1 out of every 40,000 cells is a is a stem cell. Bone marrow, 1 out of every 100,000. And fat, 1 out of every 100. Again, this is skewered a little bit because we're talking more about mesenchymal cells, but still it's an important fact. Now, we look at some adipose tissue, and we see this is sort of what it looks like in a microscopic type view. But what's so important about the fat? It's what Dr. Kaplan, Arnie Kaplan from Case Western University drives home. All mesenchymal stem cells start as periocytes. So your mesenchymal stem cells don't just come necessarily from your bone marrow. They're found on all of your blood vessels, and you can see it right here. I guess we lost our laser pointer. Somebody must have taken it or something. No pointer. Okay. Well, anyway.
Look behind you, Joe.
We have it here. Good. So we can see here these things that look like little octopuses. These are the periocytes. These are the beginning of the mesenchymal stem cells. This is what gets you better. Okay. Now again, this is another picture of what they look like, and look, they're all on a blood vessel. So usually they're just there quiescent. They're just kind of sitting there, not wanting to do much of anything. That's why you can, unfortunately, have a lot of fat around your abdomen. Your body can't utilize these cells because there's no reason to utilize them, unfortunately. Now, this is what Dr. Kaplan told us. We have a periocyte first. A periocyte becomes a mesenchymal stem cell. It becomes an activated cell. Then it becomes a regenerative mesenchymal stem cell. Now remember, as I said earlier, the mesenchymal cells don't really drive tissue regeneration. They are like, I say, a Navy SEAL strike team. They go in an area, they prepare that area so the other stem cells can do their job. They sacrifice themselves many times. They are immune modulators. But remember, the body uses a whole symphony of cells, not one cell. That's why when you try and culture one cell, it doesn't make any sense from a scientific point of view. The body uses a symphony of cells. You need to use a symphony. Fat has a symphony of cells. Fat and bone marrow are very similar. I mean, they're almost, in my mind, interchangeable in many ways. Now, again, here's what we have. We have a mesenchymal stem cell, a periocyte. It could do immune modulation, which is its main job, okay? It's an immune modulator. But it can also do these other things, these tropic things. It really can help prevent scarring. It can help prevent cell death. It can help with mitosis. It helps angiogenesis. Remember, angiogenesis means you're getting blood vessels where there's already blood vessels. Vasculogenesis, which it can also do, means there's no blood vessels to start with. It can do both things. Very important thing. Now, again, I'm stressing this thing because this is what's so important about lipogems. It's preserving these periocytes. All these other fat techniques, especially SVF, you can just put a big X for these. These are gone, okay? You're really not getting them much. So again, this is what we have. And again, this is from the work of Dr. Kaplan. Dr. Kaplan is the fellow who discovered mesenchymal stem cells. And I'll say one other thing about it. One of the things that got me interested in lipogems, Dr. Kaplan started talking about this. I said, well, okay, he must be an investor. No, he's not an investor. It's something he believes in. Same with me. It's something I believe in. I'm not a consultant for them. I don't get paid by them. It's something I think is good. I use it on my patients, and I'd use it on myself because I did. Use it on my bad knee that I had, and it's much better now. Remember that, Giorgio? As a matter of fact, I think you were in my office when we did my knee. Yeah. Okay, so anyway, again, talking about the mesenchymal stem cells, we can see all these various growth factors. that we can get from these cells. So they're powerhouses. They make drugs. They're drugstores. They're biochemical factories. Now, again, this is what happens when we don't have enough mesenchymal stem cells. We'll get this regenerative process. We'll get the adult inflammation and anti-inflammatory stuff, etc., but not much, so we get a big scar. Now, if we have a lot of mesenchymal stem cells present, we get scarless regeneration. So those of you that want to do cosmetics, mesenchymal stem cell is very important. It really helps. It stops fibrosis and things like that. So important, okay? And you can see, again, the various growth factors. These are some of the bad guys, tumor necrosis factor, and these are some of the good guys here. So, again, scarless regeneration. Now, why does Lipogems work so well? Well, what Lipogems really does is it gets these little clusters of periocytes and fat, and it kind of breaks them up into very small parts. And like anything, the smaller you have particles, the more surface area you have, the more there is to go around then. So that's one of the beautiful things. It increases the bioavailability of these cells, and it can therefore lead to good revascularization of the surrounding tissue and things like that. Now, again, I emphasize the periocytes because this is what we're doing. We're preserving this cluster. Normally, when you put stem cells in a joint or in a tendon or in a face or something, most of them perish. You're lucky if 3% of those cells survive. Now, granted, they will release their growth factors, but most of them are dead. This, because it's protecting these cells, giving them a little bit of food and some protection, you're going to get a much higher rate. You may get 10 or 15% or more of the cells surviving. So what happens? All of a sudden I go from 3% to 15%, 5 times more cells surviving. That to me is a darn good thing, something I really want. So here we are here. If we just use a free fat graft, this is what we get after about 24 hours. And believe me, I've done free fat grafts. I've done thousands and thousands of them for years, and it's worked pretty good. But look what happens when I use Lipogems. I start getting more vascularity right away, right after 24 hours. That's such an important fact. Okay, so here's the system right here. This is what you have. It's not a very complicated thing. It's a very small learning curve. The people in my office took them maybe 1 to 2 cases, and they had it down pat. So it's not that hard to do. So basically, this is, again, the system that we have. You see various things here. We do it in my office, by the way. This can be done in an operating room, but we do it sort of semi-sterile. I use sterile gloves. I use a mask. We kind of drape the patient off, but that's all that's necessary because you're just making a tiny nick in the skin. We're not doing some big extensive operation, and we're not doing that much in the way of liposuction. So here we can see, this must be Dr. Carlo. I think he's just showing you how he's getting some fat. In this case, it looks like he may even be getting it from the knee. So anyway, there's some of the product. Now here you can see here's what we're doing. Look what we've done here. Let me see if we can go back a bit. So we're starting over here and we're putting it in this chamber and we're going to start preparing it. Now once we really start preparing it, one of the problems you have with fat is there's a lot of oil in it. And believe me, when you start using fat on your clinical patients, that oil really causes a lot of discomfort. I mean, I would have patients, dying in pain, not from the procedure, but afterwards. The fat is such an irritant that it just made it so difficult that you almost didn't want to use the fat, but I knew the value of it, so that's why I would use it. And again, this is what we have. Now we get the second cluster, so we're starting to get that fat down in size. Now, since I don't really work for Lipogems, I can kind of tell you some stuff that if I really worked for them per se, I couldn't say. What we really do in the United States is we're using this quote for the purpose of cushioning. But what I'm really using it for is metabolic properties. But according to what the FDA says in our country, we can use this for cushioning purposes. So that's what I'm using it for. But in the real life, I'm using it for metabolic properties. Okay, so here we are here. So we're now breaking that fat down. We have these little metal balls in here. That helps emulsify the fat. And by emulsifying it, we then get rid of some of the oils and all the bad things. We're preserving all the good stuff and getting rid of all the junk, so to speak. Okay, and then there we are again. It's a mechanical method to isolate the cells. Now, we can see here. Let's see if we can go. So basically, we're putting in the cells, and you can see there we have like a little filter, and it's also sort of like a knife at the same time, and it's chopping up that fat. We're micronizing the fat. Okay, so there we are there. There's the fat that we're looking at. Now we're shaking it, doing the emulsification. And Then we're getting rid of all the stuff. Then what we're going to do is we're going to kind of invert things. And what does fat do? It floats. Remember, fat will float on water. Even though it has oil in it, it still floats. Even when the oil's out of it, it'll still float. So that's what we're doing. And now we're going to start taking some of the finished product out. So there it is. The fat's floating up. And there we go. We stir some more. And lo and behold, I'm getting my sample up here. That's going to be my final product. Okay, so there we are. And again, we're micronizing it some more. And that's what our final product starts looking like. And here's another thing. So here's what we're going to do. This we're going to inject into a joint, okay? That's full of stem cells. It's full of viable stem cells. It's full of stem cells that have their own little armor suit of protection. The best thing you could have, because a normal fat graft's not going to be like that. You're just not going to get the surface area that you're going to get with the Lipogems product. Okay, here's a really important thing. This is the godfather and the god of liposuction, Dr. Sidney Coleman. We owe him everything there is to basically say in the fat world. He's the one that taught us to do liposuction. But look at the size of the product that he has. And this is what I would get all the time. Look at this. This is a liquid. You can pour this with a 23 gauge needle. That's the beauty of this, okay? If you want to do aesthetics, you can get into places where you normally couldn't get. And because it's such like a liquid, it has a much bigger surface area, much more stem cells that are involved, etc. Okay, so basically it's a way of washing out the oil in the blood. We could reduce inflammation. We microfractionize the fat. We dramatically reduce the immunogenicity of it. That fat really likes to irritate things unless you do it this way. I can tell you there's a rule of fives that they've come up with in Lipogems. First 5 hours, not too bad. First 5 days, some discomfort. 5 months, the patient's really dramatically better. And that's pretty much the way it is. So the rule of fives is what I would say you follow. Now, cell transplantation. Here's Mr. Dr. Carlo Tremolata. He's the one that helped devise this. Really something good. A lot of good science behind it. A new non-enzymatic method, okay? And the enzyme's a problem. Okay, collagenase is a bad thing. It's bad for the stem cells. It's bad in your system, etc. So basically, we have microfractionated adipose tissue, and you can transfer it with regenerative properties. It's a reliable product, and it's easy to perform, and it has an intact niche. You have no idea how important that intact niche is. Now, the regenerative effect basically starts pretty much right away, and a late effect on the skin, muscle, cartilage. Usually it takes a few weeks for you really start seeing some good results. Now, interestingly enough, no infections, and this is probably way more than this now. I mean, this was, a while ago, 3,200 cases. It's probably been double or triple that now. Guess what? The mesenchymal stem cells have something called LL37. Let's talk a little bit about that. LL37 is related to catalucin, okay? This is something also that vitamin D produces. This is the only antibiotic we know that can kill both viruses and bacteria. So basically, the other nice thing about Lipogems, it's like giving the patient a natural antibiotic that kills almost all organisms. So another good thing to do. And here's some of the surface markers we found. This is a very important surface marker here, a very potent mesenchymal type stem cell. Now, Lipogems is basically, it's the simplest and less expensive source to obtain these mesenchymal stem cells. There's really no other better way of obtaining these cells, mesenchymal type cells, than the Lipogems. Now, but you got to realize it's more than just mesenchymal cells that Lipogems has. Now, let's kind of compare these things head to head. When we compare Lipogems with SVF, and I talked a little bit about this morning. Okay, with SVF, you're going to take 60 cc's, or 80 cc's, 100 cc's of fat, mix it with an enzyme, typically collagenase, and what you're going to do is break it down to get a couple of cc's. But what you're doing is probably throwing away the baby with the bathwater. You're throwing away very potent cells. I spoke this morning about very small embryonic-like stem cells. They're called mu cells in fat. You're throwing those away, guaranteed with SVF. There's no mu cells in SVF. Lipogems is preserving those cells, okay? You're disturbing the niche, okay? Once that niche is damaged, your cells really don't work too well, okay? Also, when we look at SVF, we say, oh, look at this study. Most of these studies with SVF are done in vitro. When they do them in vivo, they don't seem to work all that well with the SVF. Lipogems is the opposite. We don't do that much in vitro. We do it all in vivo, and it seems to work exceptionally well. Let's go on some more. Again, the enzymatic treatment will digest again the extracellular matrix. It probably will affect the secretory pattern of the cells themselves. It also damages the cells. And here's a very important thing, exosomes. Remember what I said about exosomes? It's like the DHL or the FedEx system of the body. When you do SVF, you're throwing those exosomes away. You have no way of transporting those growth factors from one cell to another. They just have to hopefully make their way there. It's just like sending a letter with the post service or sending a letter with DHL or FedEx, okay? Now, let's also see one other fact about lipogems that hasn't really been brought forth too much. Here's what we see the typical profile of SVF. You have these CD34s. These are hematopoietic stem cells. These are the drivers of tissue regeneration. Yet, what's the problem with SVF? Very short-lived, okay? That's a big knock on them. And the people that do SVF kind of, well, yeah, but that's okay. No, it's not okay. These drive regeneration. Okay, guess what? Since the niches are preserved in lipogems, these hematopoietic stem cells have a much longer survivability rate. So those guys are going to do the regeneration. That's why lipogems also work so well. You're preserving that complete symphony of cells. You're not throwing away the good guys. So that's another important fact, okay? And again, we're talking about the newest thinking of stem cells. This is from 2013, Mu cells. Mu cells are found in many different tissues, but we typically can put them with the fat. And we know that they're pluripotent type cells. And they are really very potent. Okay, so they have a high survivability rate upon transplantation. Lipogems is preserving these cells. Okay, and again, we can see the Mu cells over here. You do SVF, you're throwing those away, so your results aren't going to be that good. And then we have some of the factors here. These are factors that are found basically in embryonic-like cells. And we're also finding that with lipogems. So many important things, so many good things. I can't think of bad things. If I said, what can I say that's bad about lipogems? Really can't say anything about it. You get no swelling, and again, you get no bruising, basically, probably because of the exosome content. And again, let's talk a little bit about the exosomes. Again, these are multivesicular bodies. They're fused with the plasma membrane. It's the way that the stem cells send their growth factors from one cell to the other. This is what we used to think. This is what was postulated. This is what really happens. They're packaged, so they get there at the right time, at the right place, when they're needed. So, and exosomes actually are very high quality exosome, very high numbers from the lipogems product. So basically we see there's a difference in exosome content from the human adipose tissue processed by non-enzymatic means and enzymatic means. Basically lipogems versus SVF. The lipogems much, much higher. And that was from a number of different studies. So basically I'm going to end with some work from Dr. Solarski. I believe he's in Poland. And these are slides from him. I'm just borrowing these slides, but I think this gives you some good ideas. He did some studies with 60 patients for osteoarthritis. And basically we can see that their pain scores have improved significantly over a period of time. And again, we see the pain scores. We can see what they started with and what they're ending up with at 9 months. So it lasts. That's the other thing. You can do some certain things with stem cells. It may not last very long. This stuff lasts. This is for the long term. This is for the long haul. This is not a quick fix. Okay, and then you can see a cartilage defect here, treated with lipogems, pretty much healed. Okay, and so we're seeing some hard, fast evidence on an MRI, not just, oh, the patient feels better. No, we see this on an MRI. And again, we see this lesion here, and 3 months after lipogems. So it's getting better, and we've had some great results with it. And again, we can see some osteoarthritis here. And I want to note that sometimes you look at these things, you can be fooled. They take the x-ray a little different. This x-ray is taken about the same. We actually are seeing a little bit of a space here. What does that tell us? Regeneration of cartilage, number one. Number two, also very important, lipogems changes the chemistry of the joint by its cytokine profile. That's what's so important. Remember the exosomes. They're delivered where they need to be at the right time. So the conclusions are it's a very good procedure. I would treat my own family, and I've treated myself with it, and I thank you very much.